Hi, everybody. Welcome to the second video in our Building Skills on the Front Lines webinar series. My name is Morgan Scott. I'm one of the education coordinators with the Southwestern Ontario Stroke Network. And today we have Crystal Bronco, who is a speech language pathologist. She's going to be presenting today on a topic called communication access. Crystal's worked in stroke care for the last 10 years and has experience in acute, rehab, and community settings. So I'm going to hand it over to Crystal, and she's going to take it from here.
Thank you, Morgan, and thank you so much for having me today to speak with you about this topic that is near and dear to my heart. So I'm just going to share my presentation. So as Morgan mentioned, my name is Crystal Bronco and I'm a speech language pathologist. And I'm here to talk to you today about communication access, which is a topic that is near and dear to my heart. I've been working with people with communication difficulties for 15 years, and I've seen the impact that communication access can have on the lives of those with communication difficulties. Communication access allows them to get out into the world, connect with others, share their gifts, and live their lives to their fullest potential. It is magical. You are healthcare professionals working in the hospital with people who have just had strokes, and that is not easy. And so ask yourselves, why do you do what you do? I would imagine that it's some version of to help people, and that is amazing. And you would know that good communication is needed to help others. And you would also know that the better able you are to communicate, the better able you are to help someone. So today, I hope to share with you some ideas on how to enhance your communication to help your patients to your fullest potential. So what is communication? Communication refers to an exchange of information between two or more people. This is a partnership. So when you're communicating with someone, you need to receive the message. So you do that by listening to what they say. You are watching what they are doing with their body and their face. You may have to read some information that they are adding, or you may have to look at some visuals that they're presenting. When you give information, you may be talking, using gestures or facial expressions. You may be writing things down, and you may be showing pictures or other visuals. And hopefully there's an opportunity to verify and make sure the message has been received accurately. So why might communication break down? Well, you're working with people who have just had a stroke. So perhaps the stroke has caused a communication impairment, such as aphasia, a cognitive impairment, or a motor speech disorder. Perhaps the stroke has caused sensory difficulties, impacting their hearing and their vision. Perhaps the person is very stressed, which can make communication difficult. Perhaps the person is in a lot of pain, which can make focusing on the conversation difficult. Depending on the medications, there could be reduced alertness levels, which could also make it difficult to converse. But there also may be some pre-existing difficulties that can make communication difficult. Perhaps there is a learning disability. Maybe they speak English as a second language and their grasp on English is not strong. Or maybe they have a hearing impairment, which would be common in our older adults. And so as we're going through this information today, we're most likely thinking about communication difficulties in the context of our patients. But you may also want to consider that these communication difficulties could be present in family members, your own colleagues, or even in yourself. So these strategies are helpful for everybody around you. And another quick note is that even though there's a communication impairment, it doesn't mean they're incompetent. A communication impairment can mask competence, and using communication strategies can help to reveal competence. So now we want to ask, so what if communication breaks down? How would this impact your service? Well, if you don't understand what someone is telling you, or they don't understand what you're saying, then misunderstandings and mistakes can happen. And this will impact the trust and respect you have in the relationship. And ultimately, it can decrease the quality of the service that you're providing. So I think we can all agree that optimal communication is necessary for good service. So what is communication access exactly? To help define communication access, it may be helpful to first think about physical accessibility. What comes to mind with physical accessibility? Perhaps ramps, automatic door openers, wheelchairs, walkers, canes, elevators. These supports are necessary for people with physical disabilities, and they can be helpful for everyone else. So now think about communication accessibility. What comes to mind? Well, these are the strategies we can use to get the message in and out. In other words, these are strategies we use to help people understand what we are saying and to help the other person to express themselves. The Toronto Aphasia Institute has called these strategies supported conversation strategies. We need to think about communication access for face-to-face communication, telephone communication, and with reading and writing. Similarly to physical accommodations for individuals with physical difficulties, using communication access strategies is necessary for some and beneficial for all. In using these strategies, you're making your service inclusive for everyone. Before even having a conversation, it is important to set up the environment for success. So we want to optimize your environment. Finding a calm, quiet, and private environment will help to reduce distractions, improve everyone's ability to focus on communication, and create a safe space for difficult content and moments. Sit down with the person and tell them you have time. This can help to alleviate the pressure and allow for the mind to function better, which will help them improve their concentration and problem-solving abilities. If you do not have the time, just be honest about that and ask if you can get someone else to help or if you can come back later when you do have time. Ask if the person has hearing aids or glasses. If they have them with them, support them in wearing them. And if they don't have them handy, then you will be more aware of and be able to accommodate for these sensory deficits throughout the conversation. Have a paper and pen handy to use if needed. We will discuss this a little bit later on. If optimizing the environment is all you can do in the situation, then you are already making a significant improvement in the ability to communicate effectively with others. This is a fundamental step that will give you a big bang for your buck. So being in the healthcare industry, you know the importance and you're probably masters at showing respect. When we work with individuals with communication difficulties, there could be some subconscious behaviors that show up. And we certainly do not mean to do these things, but if we do them, it could unintentionally send a message of disrespect. So the first one to keep in mind is to use a normal tone of voice. And the second is to use a normal rate of speech. Think about when an adult is talking to a child. If we change our tone and slow down our rate of speech too much, it could sound patronizing. So try to witness yourself in these situations and make a conscious effort to normalize your tone and rate of speech to communicate respect. A very powerful message to send to people with communication difficulties is, I know you know. Individuals with communication difficulties can be very worried about what their listener is thinking. Their communication impairment can mask their knowledge, and this can be frustrating for them. By you acknowledging that you know they know what they want to say, and it is hard to get it out, It can alleviate the pressure and the frustration they feel. Finally, ask the person how you can help. This gives the person permission to ask for what they need, and it also demonstrates that you are committed to being a partner in the communication process. Being respectful can help to build trust in your working relationship, and if there's trust, then both parties will be more willing to take risks and persevere during the difficult communication moments. So now we will get into the direct strategies you can use to help get the message in and out. For time purposes, we will just focus today on face-to-face communication, but please keep in mind that all communication in all language domains may need accommodation. So telephone communication, reading and writing, those environments may also need accommodation. Help your patient understand. So let's talk about what you can do to help get the message in. First, you want to say one thing at a time. We are excellent at saying a lot at once, and this can be problematic for someone having difficulty concentrating or following along. Simplify your language. We may need to think about the complexity of the vocabulary we are using. For example, medical jargon is difficult for the average person to understand. Add a communication difficulty on to that or a difference in language. The simple words are easier to understand. Add on visuals when you can. As you talk, use gestures, objects in the environment, show or draw pictures. These strategies require no language skills to understand and are very powerful communicators. And then add simple written information. Keywords or simple notes will provide another mode of accessing information. This can help the person follow along, and as a bonus, it could be used for future reference. So when we talked earlier about having a pen and paper handy, it would be to be writing down simple notes or keywords. This could be a pen and paper, whatever you have access to. It could be a whiteboard that's already in the room. Ideally, it's blank paper with a black Sharpie. Let's go through an example. You need to tell your patient that they have an appointment for an echocardiogram. They need to leave now, and they will be taken on a stretcher. If we think about the strategy one thing at a time, let's break this down. And you'll note that the asterisk means that you're going to be pausing between the comments. So we have an appointment for an echocardiogram. We have to leave now. And you're going to be taken on a stretcher. If you're going to simplify your language, how would we do that in this context? Well, echocardiogram may not be understandable to the average person, so you may change that to heart test. Leave now could be simplified to go now. People may or may not know the word stretcher, so you could simplify that to another bed. This might be how you add visuals or simple written information onto the communication. You have an appointment for a heart test, so you may have a picture of that to show them what you're referring to. We have to go now, so you may have a picture like this, or you could point to your wrist to indicate go now. We have to get you into another bed. So you may have a picture like this to show them what the stretcher looks like, or perhaps the stretcher is out in the hallway or it's already been rolled into the room that you can point to. And then you want to verify. After you've provided the information, stop to make sure they have received your message. This could be as simple as watching their facial expression and body language to get a sense of whether or not they are understanding, or as in-depth as using a strategy such as Teachback, where you have them tell you what they understood. Using Teachback is an excellent method of hearing what the person understood, giving them an opportunity to ask questions, and to tell you where further clarification may be needed. And now understanding your patient. Regardless of the level of impairment, you always want to start by giving the person the opportunity and time to communicate as much as they can. So, whether you have asked an open ended question or they are trying to initiate communication with you, you can encourage them to tell you, maybe to write something down. That could be a word, it could even just be the first letter. Maybe they can draw something or a symbol, or maybe they can show you something that's in their environment. The various means of getting the message across may not come naturally to the patient, and so modeling these strategies and explicitly suggesting that they use them could be helpful. So, after you've given the person sufficient opportunity to communicate their message, you can start to ask questions to get more information. So, you want to try to ask one question at a time and let them respond before moving on to the next question. For example, if you say, "Good morning, how are you? Can I help you with anything?" If they nod their head, how would you know which comment or question they are responding to? You also want to be mindful of the type of question you're asking. Yes, no, and choice questions are two types of closed ended questions that could be helpful since they reduce the communication demand on the person. For example, compare "What would you like?" which is an open ended question, versus "Do you want a drink?" which is a yes no question, versus "Would you like some water, tea, or coffee?" which would be a choice question. And of course, when you ask a closed ended question, you want to remember to write down the key words in the question and write down the choices so that they can point to their response if they cannot say it. And once you feel like you understood what they communicated, take a moment to repeat it back and confirm that you have understood correctly. So let's go through an example. You know your patient is trying to tell you something. You want to figure out what it is. So first step is you give them time. So either pull up a chair and sit down beside them, bend down, just be at their eye level. Those nonverbals indicates that you are giving them time. And you can even say, "Please take your time." Encourage them to give you clues. Can you tell me anything? Can you show me something? Here's a pen and paper. Can you write something or draw something to tell me, to give me a clue? If they are not really giving you any information or any clues, then using your own experience in what people might be trying to tell you or ask you, you can give them some options. So these are some common things that a patient might be wanting to ask or ask you about or tell you about. And so you can present them with a piece of paper with these visuals and the written words and see if anything resonates with them. So hypothetically, if they point to phone, then that's a clue for you. Okay, so now using your knowledge of the person, you can start to ask some questions. So a yes no question might be, do you want to call your daughter? Do you want to call your husband? Or a choice question could be, did you want to call your daughter or husband? And of course, verifying that you've understood their message. So I have a case study to go through just to help to consolidate all of these strategies. And we're going to talk about Mr. B, who has expressive aphasia. So he's very pleasant and friendly. He has relatively good comprehension. He speaks English, but his first language is Italian. When he tries to speak, he's able to generate only few words. He's got a right hemiparesis and neglect. His reading is impaired and his writing is impaired, and he uses his non-dominant hand. So the communication task is you want to find out what kind of house he lives in. So as an overview, first things first, you want to optimize your environment. You want to be respectful. You want to help him understand what you're asking and saying. you want to verify he understands, and you want to help him respond and express himself. And then you want to verify that you've understood what he's told you. So because he's got the right neglect, you want to sit on his left side to make it easier for him to pay attention to what you're showing him. And you're going to say to him, I want to ask about your home. You will write down your home and perhaps show him a picture of a house. And then you point to him to indicate you're talking about his house. So you wait for him to indicate understanding and that you can proceed. So this might be an example of the visual. So you've written down your home and you have a picture of your home. And then you want to ask, what type of home is it? You write down type of home and you have pictures available to give him some options, such as a house versus an apartment. And you want to wait to see if he can give you a response verbally, or he can point to the options on the paper. So he points to house. So this would be an example of what that visual could look like. So he's pointed to house. So you want to say, so you live in a house, circle the picture that he pointed to and wait for him to verify. Once he verifies, yes, that's what he meant, then you put a check mark beside that one. And it would look something like this. And now you want to know about the stairs in the house. So you ask, how many floors? You will write down how many floors and give some options, 1, 2, 3, or 4. You can hold up fingers to indicate the numbers. And then you wait for his response. So he may be able to respond verbally. He may be able to hold up the number of fingers, or he can point to the options. And hypothetically, he points to the number 2 on the paper. So the visual might look something like this. So now you want to verify. So your house has 2 floors. Circle the picture he pointed to, wait for him to verify, and once he verifies, put a check mark beside the number 2. And it might look something like this. Now you want to know about his stairs, because he could live in a 2-story house, he could live in a side split. So you might ask, how many stairs? And then you're writing down how many stairs. And then you give some logical options, 5 to 6, 10 to 12. And then on top of that, you might have a visual, a picture of a short flight of stairs versus a long flight of stairs. And so you wait for his response. Maybe he responds verbally, or he can point to the options on the page. So in this example, he's going to point to 10 to 12, the long stairs. So it might look something like this. So because he pointed to the 10 to 12, the long flight of stairs, just to verify, you'll ask, so your house has a long flight of stairs? And then you'll circle long flight, wait for his response, wait for him to verify, and once he verifies, you put a check mark beside long flight. So it may look something like this. So I hope that final example gave you some ideas of how to put these strategies in practice. Thank you so much for your attention today.
That's so great. Thank you so much, Crystal. Once again, guys, this is video 2 from the Building Skills on the Frontline webinar series. So there are 4 more videos to watch online on our website. And if you ever have any questions about aphasia or resources that can support your learning around aphasia, please reach out to Swason at lhsc.on.ca, or you can reach out to myself directly, Morgan Scott, through Swason. Thanks again to Crystal, and that concludes the presentation today.